So why do a single tooth implant if you're only missing one tooth? And what's the advantage over the traditional bridge?
So I would say, and within my office, I would treat the patients like I would treat my mother or somebody in my family. So if you came in missing a tooth, the traditional way of restoring this area would be with a 3-unit bridge. So you would shave the tooth on one side, you'd shave the tooth on the other side of the space, and you'd end up with a bridge. So that involves 3 teeth. The better way to go about it is to have an implant placed and have that implant restored. And that way you will have a tooth that is fully functional, is not attached to the adjacent teeth, is a little easier to clean than would be a bridge.
All right.
You don't have to floss underneath it. And ultimately, it's a better long-term solution because the bridge you may have to replace at certain stages, and an implant is a little bit more solid when it's a single tooth placement.
So an implant for like a 30-year-old, 40-year-old, 50-year-old could last 30, 40 years, like as long as they live?
It can. They have
Okay.
to still...
Where a bridge only lasts like 10 years, 12 years?
Generally, a bridge will last 10 to 12 years. And though they can last longer, that's probably the average. And an implant can last well beyond that because the implant placement, they allow the healing to occur before we place the crown on top of it. So problems afterwards, I would say there's probably a 98% success rate with dental implants. And it's much lower long-term for a bridge.